Today we will discuss hypertension with pregnancy. Classification. Hypertension in pregnancy may be chronic hypertension, preeclampsia or eclampsia, gestational hypertension, preeclampsia superimposed on chronic hypertension. Those are types of hypertension associated with pregnancy. Chronic hypertension definition. Hypertension and either of the following may be present prior to pregnancy or present prior to 20 weeks. So if I have a patient and it is already have hypertension before pregnancy or hypertension before 20 weeks of pregnancy, so it is a chronic hypertension case. Gestational hypertension, it is hypertension which starts after 20 weeks of pregnancy with absence of proteinuria, absence of severe features, followed by return to blood pressure to normal within 12 weeks after postpartum. So chronic hypertension was before 20 weeks of pregnancy. Gestational hypertension is after 20 weeks of pregnancy and associated with and will disappear after 12 weeks if disappears within 12 weeks after postpartum. Gestational induced hypertension. Induced, not gestational, but gestational induced hypertension. Induced why? We have to exclude preeclampsia and eclampsia up to 160 over 100. Start pharmacological treatment with LSM above 160 over 100. Pregnancy and antihypertensive. Antihypertensive drugs known to be effective and safe in pregnancy include methyl-dopa, labetalol, diltiazem, clonidine, barzolvoxine. Chronic diuretics has been associated with restricted maternal plasma volume, which may reduce uteroplacental perfusion. So, chronic diuretics has been associated with restricted maternal plasma volume, which may reduce uteroplacental perfusion. Oral antihypertensive drugs in pregnancy, methyl-dopa, labetalol, and nifedipine are safe. Diuretic, take care from this point, as those are the most widely used antihypertensive. Diuretics, ARBs, and ACE inhibitors are contraindicated in pregnancy. Beta blocker cause fetal growth retardation and bradycardia. So diuretics, beta blockers, ACE inhibitors, ARBs or ARB blocker, angiotensin receptor blocker, all those are contraindicated in pregnancy. Preeclampsia. Definition. Hypertension, new onset after more than after 20 weeks plus proteinuria, or hypertension, new onset after 20 weeks plus multisystemic signs, CNS, pulmonary edema, renal dysfunction, liver impairment, thrombocytopenia. Each of them you will consider case as preeclampsia or eclampsia according to categories that we will go through now. Followed by return of blood pressure to normal within 12 weeks postpartum. Proteinuria is not required for diagnosis. So you can diagnose open if there is any organ affection. Eclampsia. Eclampsia. We are talking about pre-eclampsia. Eclampsia, it is a generalized tonic-clonic seizures in a patient with pre-eclampsia, not attributed to any other cause. So a patient, pregnant patient, have eclampsia and she goes through tonic-clonic seizures, so it is an eclamptic patient. So eclampsia equals preeclampsia plus seizure, convulsion, or coma. Oral antihypertensive drugs in lactation, atenolol and nifedipine, are avoided. Thank you.